Hey everyone, welcome to another quick episode of Healthcare Funding, M&A, and Partnership Announcements. I'm your host, Jared Taylor. Joining us once again in the slice of healthcare ecosystem is Dr. Jenny Schneider, the CEO of Homeward. Jenny, how are you today?
I'm great, Jared. Thanks for the opportunity to chat.
Excited to have you back on. We have a lot to cover today, a lot of great announcements for you. Would love to kick things off by giving us a little bit, some background on the recent raise, who participated, what this means for the company, and then we also want to talk about, in combination with that raise, you also announced another huge partnership. A lot of people remember the Rite Aid partnership not too long ago, and now this new relationship. So we'd love to hear on both fronts, and I'll kick it over to you to tell us more about what's happening.
Yeah, thanks so much for the opportunity. So maybe I'll start with the overarching theme here, which is delivery of health and care in rural markets is massively broken. And so Homeward is bringing forward a new approach, and our market traction, as evidenced by our partnership with Priority Health and their innovative thinking, drove a lot of the investment. So we were not actually looking for funds, but I think there's a lot of excitement in this marketplace right now, and in particular around our team. So we were delighted to get to announce a $50 million raise co-led by Arch Venture, Human Capital, with General Catalyst, who is the team with which we started the company, and Glenn Tallman and Lee Shapiro joining us.
That's awesome. It's all those are great firms to be working with. Must be cool too to be able to work with, continue to work with Lee and Glenn. Back from your days in Longo. That's awesome. So it sounds like you weren't looking for this, and it came about, and that's usually the best time to raise when you aren't looking for it. Can you talk us through, because when you came on the Titans of Healthcare podcast, we kind of talked a little bit about the state of digital health and healthcare, investing, and how, for some companies it might be more difficult to raise than others. But can you talk us through a little bit about that process? And I think it speaks to the company you're building too, for you to be able to raise a sizable round in this market. But would love to hear more about your perspective on kind of how it did come about, and then, what you're excited to use those funds for.
Yeah, so maybe I'll start by saying, there are incredible venture partners that are looking for massive problems that are being solved by experienced teams, and we fall into that category. So we're in a little bit of a different realm. Like we talk about, 1 out of 5 people lives in a rural market, and people who live in rural markets have a 23% higher mortality. So there's a very big opportunity here. And our philosophy as we founded the company, Amar Kendall, myself, and Hemant Taneja, was really to focus on something that mattered in the ecosystem and partner with people that could help us capitalize the business as we grew, and go as fast as we could in a way that was useful to our members. And so we are really excited with this additional capital to continue to execute, to deliver, and to expand into additional markets. And I think really what it speaks to, and we'll talk more about the partnership with Priority Health, is again the massive opportunity and the massive need in front of us.
And what came first? Was it the partnership with Priority Health, or was this round? I know you combined basically the announcement of the two, but what came before the other?
Well, the partnership with Priority Health is something that we've been working on for a while. And again, we are so impressed with their innovative thinking and how they're leading. Keep in mind that Michigan has the 3rd largest Medicare eligible individuals living in rural markets, and 50%, so half of the counties in Michigan, are rural. And Priority Health is a very large payer in that market. But even more importantly, they partner with Spectrum Health and Beaumont Health, the largest health system in the state of Michigan. And so it's our approach around developing a partnership and coming in to escalate and make sure that people are able to get the care they need. They were the perfect partner for us. So in many ways, that conversation was going on for a while as we were thinking about building the business.
And talk us through a little bit about twofold here. What this means for the industry and the patients that you'll be helping, and then what it means, I guess, just and I'm guessing part of this, like also when you say what it means for the company, most of all of that should be related, but would love to hear that from you.
I think the most interesting thing about what's happening in the industry is you're seeing the likes of a Homeward and many other great companies really focusing on health equity, really focusing on people who don't have access to high quality healthcare and working to deliver that to individual people. And the model in which to do that is different for different companies. For our model here in rural markets, really what we have to do is be able to scale services. So we know the number one problem in rural markets is access to healthcare services. We also know that we don't have a magic wand that we can wave to magically make doctors and nurse practitioners appear in these markets. So instead, it's really enabling and using the technology components to scale the services in these markets to deliver that high quality care. And that's something that from previous background, we've been able to do and are really excited to apply into this marketplace.
It's super exciting to see just also how quickly you're moving. Like you're, it really speaks to your experience, your team's experience, and I think when we look at the funding landscape, right, it's no surprise that individuals and teams like yours are getting funded because you're operators, you're innovators, you've been there, done that, and it doesn't matter what people think about where the economy is or heading or what you're gonna power through and you're gonna create something special. It's just we've only had a couple interactions, but I can already tell like just who you are. Plus the proof's in the pudding, right? Like, by the way, everyone that I've met that has worked with or knows Jenny they've just all say so many great things about you, and it really speaks to who you are as a person, as a leader. So kudos to you on everything that you've built so far and will continue to build.
Well, thank you, Jared. As I said, our next part of this journey for us as a business is heads down pure execution. And we have a stellar leadership team, and we're really excited to go do that. Really excited with the partnership with Priority Health. And so lots of work in front of us, but that's why we're here. And so really excited for the opportunity.
Well, I'm really excited to continue to follow your progress with the company, and hopefully we can have you come back on again to talk about some of the more partnerships that you're putting together, because I have no doubt we'll keep hearing about them.
Sounds great. Thanks so much.